What if I told you Ozempic doesn't just reduce your appetite? It actually changes how your brain processes hunger. And not just your brain. Your stomach slows down. Your pancreas behaves differently. Your insulin changes. Your fat cells respond. Even your reward system shifts. Ozempic isn't just a weight loss drug. It's a full-body metabolic signal modifier. Today, we're breaking down exactly what happens inside your brain and body when someone takes Ozempic, step by step, organ by organ, in simple language. No hype, no fear, just science. Let's start with the brain. Ozempic is a GLP-1 receptor agonist. GLP-1 stands for glucagon-like peptide 1. Normally, your body releases GLP-1 naturally after you eat. It helps signal fullness. Ozempic mimics that signal. But here's where it gets interesting. Your brain has appetite control centers, mainly in the hypothalamus and brainstem. When Ozempic activates GLP-1 receptors there, hunger signals decrease, satiety signals increase, food noise quiets down. Many people describe it as, "I'm not constantly thinking about food anymore." That's not imagination. It's neurochemical. Cravings and dopamine. Hunger is not only physical, it's also emotional and reward-based. Food activates dopamine, the brain's reward chemical. Highly processed foods especially trigger strong dopamine spikes. Emerging research suggests GLP-1 medications may reduce dopamine response to food cues, meaning cravings weaken, emotional eating decreases, reward response shifts. Some people even report reduced desire for alcohol or compulsive behaviors. Why? Because the reward loop in the brain becomes less reactive. This is why Ozempic feels different from dieting. It's not willpower, it's altered signaling. Now let's move lower. Ozempic slows gastric emptying. That means food stays in your stomach longer. Normally, you eat arrow food moves to intestines, blood sugar rises, hunger returns. With Ozempic, food moves slower. Result, you feel full longer. Blood sugar rises more gradually. Hunger returns more slowly. That's why smaller portions suddenly feel satisfying. But this is also where side effects come from. Slower stomach emptying can cause nausea, bloating, constipation. The body is adjusting to a slower rhythm. Originally, Ozempic was developed for type 2 diabetes. It works strongly on the pancreas. When blood sugar rises, Ozempic increases insulin release, but only when needed. This is important. It doesn't constantly force insulin. It enhances glucose-dependent insulin secretion. That helps. Lower blood sugar spikes, improve insulin sensitivity over time. It also reduces glucagon, a hormone that raises blood sugar. So now, less sugar entering blood, more controlled insulin response, better metabolic stability. For people with insulin resistance, this is powerful. Now let's talk about fat. Ozempic doesn't directly burn fat. Instead, it changes the hormonal environment that allows fat loss. When hunger drops, calorie intake decreases, insulin stabilizes, your body becomes more willing to release stored fat. Insulin is a storage hormone. When insulin is constantly high, fat storage is easier. When insulin stabilizes, fat release becomes easier. This is why many users lose weight gradually over months. It's hormonal shift plus appetite reduction, not magic. Biology. Recent research suggests GLP-1 medications may also reduce cardiovascular risk in certain populations. Possible mechanisms: improved blood sugar control, reduced inflammation, weight reduction, lower blood pressure. Some large studies have shown reduced risk of heart-related events in high-risk patients. But this doesn't mean it's a universal heart drug. It means metabolic health and heart health are deeply connected. Every medication has trade-offs, common side effects: nausea, vomiting, constipation, fatigue. Less common but serious concerns may include pancreatitis, gallbladder issues, rare thyroid tumor risk seen in animal studies. That's why this medication requires medical supervision. It is not a cosmetic injection. It is a hormone-modifying drug. So what is Ozempic really doing? It's not melting fat. It's modifying communication between gut, brain, pancreas, fat tissue. It reduces hunger, alters reward pathways, stabilizes blood sugar, changes metabolic signaling. That's powerful. But it also raises a question. If we chemically silence hunger signals, what happens when the medication stops? This is where lifestyle and long-term habits matter. Because once signaling returns to baseline, appetite may return. Ozempic is not just a weight loss trend, it's a metabolic intervention. It changes how your brain interprets hunger, how your stomach processes food, how your pancreas releases insulin, how your body stores and releases fat. Understanding the science helps you make informed decisions, not emotional ones. If you found this breakdown helpful, subscribe for more simple explanations of complex science. Your body is more intelligent than you think, and the more you understand it, the better choices you can make.